14th of April 2020 meeting. If you are attending the meeting live with us now at 6 o'clock and you would like to have a question answered or a comment heard, please put your hand up virtually or in the chat. You can post your question and we will try and get to it. If you're watching on Westford Cat, then obviously you won't be doing that. But if you are on Westford Cat and it is 6 o'clock and you would like to be on the call, you can log in and join the conversation. So I'm calling this meeting to order, April 14th, 2020 of the Board of Health. And our first discussion item that I just wanted to talk to you guys about is our next meeting. I was thinking that maybe we want to go to bi-weekly meetings, so every 2 weeks. We had for the past few weeks meeting every week, but as I've been talking to Jeff, it sounds like, you know, for instance, this week, we're just kind of in the same mode. There's not a lot of new information. And so it might not be that we want to meet every week. So I'm just kind of polling you guys to see how you feel about that.
That makes sense.
No, I'd be fine with that. Well, it's always changeable. If something important comes up, we can call a meeting when we need to.
Yep.
Yeah.
I just need you to know that I can't do any Tuesdays going forward. So, you know, I'm kind of hoping that we can go back to our regular Monday schedule, and then if something comes up, then we have a meeting, but Tuesdays will be out going forward.
Well, yeah, I mean, the only reason we had been doing Tuesdays was to get kind of the updates from the Department of Public Health, because those are their Tuesday, fall meetings at mid-afternoon. But I don't know, I kind of agree that that's not as pressing anymore.
Yeah.
So if you guys want to go back to our Monday schedule, so if we were going 2 weeks and looking at Monday, we'd be looking at Monday the 27th.
Yeah.
If that works out well for everybody, we could do that.
Yeah. That looks
Do we
good.
have to meet every 2 weeks? I mean,
We don't have to do anything. It's totally up to you guys. Just when this started and because there was so much moving information, we had been doing it every week, but we could go back to a more regular schedule if you'd like.
So Zach, the next meeting date, our normal meeting date would be Monday, the 11th.
That seems like a long time.
There's
Why don't
going to be a lot going on, I think, between now and then in terms of resuming activities.
so maybe do, you know, if we could go back to Mondays, and again, that would be helpful for me because I can't do Tuesdays. And then maybe in 2 weeks, and then 2 weeks after that would be our regular meeting, and then how it is after that.
Yeah.
Yeah,
If we don't meet on Tuesdays and something significant comes up when Jeff is on the MDPH meetings, he can always let us know, and we can always have a special meeting if we need to.
Yep.
Sounds good.
All right. So then, if you guys are good with it, we'll schedule Monday, the 27th of April at 6 p.m. for our next virtual Board of Health meeting.
Sounds good.
Okay. Now that we got that business out of the way, our next discussion item is regarding face coverings. And as you may have heard, there are different towns in Massachusetts that have decided to go to either mandatory face coverings when people are in public, or that some have issued advisories. And so I just wanted to start a discussion with everyone here, not to say we have to do anything tonight, but just to see how you guys are feeling, if there's any information you'd like to share regarding face coverings. Just to put it out there, I do think it's a pretty smart idea. I've been following Asian countries pretty closely, and their only real difference in what they say is that they take a lot of the same precautions that we do with social distancing, but a lot of these countries are back to work or back to school, or some of them never even stopped going to school and still have very low transmission rates, and largely seems to be because they're using face coverings when they're in public. People I've talked to there say that especially when they get on mass transit, or especially when they go into stores, they definitely seem to all be wearing them. Not always when they're walking down the street, but they always have them at the ready. And so that's a big change for us Americans to be, having face masks as part of our attire when we go out. But I think we're all starting to see that it is a good tool. And there's been a lot of misinformation about them. Obviously, we're not asking everyone to wear N95 masks or respirators. We definitely want to save those for our frontline medical staff. But face masks that you can make at home are readily available and easy to make. A lot of people have already been making them. So the question kind of becomes, I don't think we want to be demanding that everyone, you know, as soon as they leave their house has to wear them, especially if they're going for a walk in the woods. But I think we might want to be thinking about things like public places that are dense, like a supermarket, so businesses and public buildings. So I'm just going to throw that out to you guys to see what your thoughts are.
I know that, well, we've said that they're fairly easy. I'm in the middle of trying to make a bunch for friends. Elastic's not available, so I think that at this point, maybe encouraging it in those places, but giving people time to acquire them would be critical.
Yep.
But you know what? Even if you can't wear a mask, even a scarf, I mean, everybody's got scarves, right? So I've never put a scarf on. What's that? I think you're going to be hard pressed to see some kids like my son choose to put a scarf.
I know, but I was talking to somebody who was a positive COVID, and she said she really has trouble with the masks. And I said, well, what about a scarf? So I really do think there are different options. It doesn't have to be a formal mask, but I mean, I agree. I have to say, when I've been going out in public, I do have a mask on now. I just, like, if I go to the grocery store, I do. Because it was a recommendation that, from the CDC, like, to me, it makes sense. The only question I actually have is, are the workers supposed to be wearing masks or no? Like grocery stores, Dunkin' Donuts, are they supposed to be wearing them or no?
Well, I heard from a neighbor today who shopped at Market Basket. She said that there were no lines outside, that it was very organized, that the aisles were one way only, and that when she got to the cash register, there was a plastic plexi shield in front of her and the cashier was wearing gloves and a face mask.
Okay.
Last I had heard, it wasn't a mandatory thing, but that they could if they wanted.
Okay.
Well,
It's not, it hasn't become mandatory, and I just wanted to say something too about the face masks, because there's other things other than scarves, like motorcycle riders. We have things that you can put on. My thing with the mask was, and Sue, we go on for this, people who are running or riding their bikes or things like that, you can't. And some people, like you said, Sue, have trouble breathing in the masks, whether they have a respiratory issue or something. So, just face covering, whatever you can put on is good. And wear it the right way. I saw somebody the other day, it was upside down.
I don't think you have to wear a mask when you're going for a walk, going for a run, or going for a bike ride. I just don't. It doesn't make sense to me. Because first of all, like when you're, I went on a nice bike ride the other day. To have a mask on, I would have had trouble breathing. It would, I'm by myself, so I don't think that's necessary. Yeah.
The other thing
I agree
about is education around it, so that when people have their mask on and they go and take it off, we somehow got to teach them.
Well, that's what I was saying. That's what I was saying about wearing it the correct way, because actually, I was in the grocery store and I didn't want to do it, but I saw a woman with, how the top you press into your nostrils. She had it down underneath and pressed up against her chin. So it was upside down. And then I think too, I would like to see if we're going to put something out very strongly. One, how you put them on, how do you take them off? But with gloves, I'm appalled. And it stopped, but there was last week or the week before, there was gloves like on the ground, on the, in the parking lots, the grocery store. And like, I think we need also to put something out about, how to wear the equipment, when you should wear it, and then how you dispose of it properly and safely. And because I was just so sad seeing like all these gloves all over the parking lot. It was nasty.
So I think we kind of nipped that in the bud a little bit with the grocery stores. We had staff go out to all the grocery stores. They talked to everybody at them to get barrels put out, and we've already seen an improvement there. So that I think we at least solved. If we gave people a place to put their gloves, they're just not dropping them on the ground.
Mm.
So there's already been some market improvement in that category. I'd like to say that I did recommend to all town employees today that I strongly recommended they wear some sort of face covering. And that went out to all town employees. And I think I included all of you on that email as well. I think it's important that we go forward with that kind of recommendation, and a strong one, and the education that goes along with it. And we have to remember that, and people need to remember that a face mask and a covering does not negate the need for the social distance. So
Absolutely.
in conjunction, it is a piece of the strategy to stay in front of this. And I think if we have a simple document that strongly resolves that you are willing to stand behind, I'm able to put that out there to all the businesses, the stores, the essential services that people are going to on a regular basis, to try to really strongly encourage the wearing of that mask and that covering. I think that's maybe the strongest thing we can do.
I just want to make sure, I mean, I agree. You know, if somebody forgets it or doesn't have one, you know, they're running in to get a pizza or something and they forget, I just want to make sure that, you know, it doesn't become a thing and we get a lot of calls. I mean, there are people out there that that could happen to, you know, and these things happen.
Well, I think that's important, where maybe the punitive piece of an order will be more protective of some people, as far as nobody wants to fine somebody $1,000 for having a mask on. And there are some communities that have done pretty punitive things with their orders. Our population density is only something like 738 people per square mile. And there are other towns that have got a far higher population density than that. I think if people can understand here that wearing it is strongly recommended, I'd like to see the self-policing of our own people and having people wear a mask than a punitive action for doing so, or for not doing so.
So I really think, you know, the education around this is the really critical part about, you know, when and how. And I'm wondering if there are if we can work on getting maybe some good pieces that we could throw out onto social media too, to share in town to the different groups and things that we're on various social media streams, to kind of reach people, to help them understand, you know, yes, a mask is an important thing to wear in times like this. And remember, part of that is how you remove it, and, you know, some of these things, so that you're not then.
Yeah, I couldn't agree more. Proper way to don it, doff it, and dump it.
Yeah. Donned off dump, we can have a little something there.
And for the fabricated masks, they're washable and reusable, right?
Yeah.
Yes.
Right. There's a couple different strategies that were in an article. I don't know, Jeff, if you were able to put some of those up from that article.
I put up some of those, but the one I've been really using is what the CDC recommendations are. And the CDC has got several posters that, in fact, one should be going into the town manager's newsletter this week on how to make a mask and how to wear it.
Because they said, you know, you can take it off and put it in a bag for 5 days and then use it again, or you can wash it. But those would be your options.
So maybe the thing that the board would like to do is pass a resolution to strongly support the wearing of face coverings.
Yeah,
And
I would like to stipulate that it be in public buildings and businesses. I think that,
Right.
you know, obviously people can wear them more than that if they want to, but I don't think, like, you know, Sue was saying, if you're going for a bike ride or a walk, that it's necessary.
Yeah. No, that sounds good.
But I mean, there might be some things I'm not thinking about. So I mean, public buildings and businesses is, I think, a good start, but maybe I'm not.
Gatherings. Well, we aren't having gatherings, so.
Right. I mean, we shouldn't be having
Yeah,
gatherings.
there's no gatherings.
Well, again, I question, are the workers supposed to be wearing them? You know, I know you said, I was in a
Well, this
Dunkin'
would-
Donuts and nobody had gloves, masks, anything. So I'm like,
I
what
mean,
is?
Right. I mean, so this would cover that, I would think, because if you're, working at a business, so Whole Foods or, Dunkin' Donuts, then you should be wearing a mask.
Well, I think I was just surprised because, I walk into Dunkin' Donuts with my mask on and my gloves, and the workers there didn't have anything on. I was
Right.
like, that's
Right.
strange. Yeah. Yeah.
I mean, I agree.
They don't have to. It's not mandated yet, and industry by industry.
Yeah.
But it's not required. And again, the other thing with masks too is you can't wear them for hours and hours at a time.
No,
You have to
I
take them
know.
off. You have to take
Yep.
them. So
Sure.
there's an issue then with supply, and are
Right.
they going to have people wearing? Sorry, my phone's ringing. They have people wearing masks, and
Yeah.
is it going to get in the way of whatever they're doing?
Yeah.
They should be wearing gloves anyway.
Yeah.
And I
And so
don't know
that's
why my phone's ringing.
For masks going in, then we are helping at least protect them as well.
So I could draft that resolution to all residents are strongly advised to wear face coverings in all public buildings, any essential business that's open to the public, all employees are strongly recommended to wear masks or face coverings. I'm going to try not to use the word masks because that does indicate
Yeah.
Confusing.
face coverings in any business open to the public. And I would recommend that any resident entering or exiting a commercial building or complex should have a mask on.
Yep.
We do have face covering. I'm going to stop saying mask.
Yeah. 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 Have any other businesses, restaurants in town decided to close their doors?
So right now, I believe Ray and Arnie put a number somewhere around 45 businesses that have closed as far as the restaurants go. It may have gone up, but I think it's right around 45. One thing the office has done is there's already a plan in place to reopen businesses. So we've got between myself and Arnie and Abby and Ray, we've got 4 people that are capable and qualified to go and do the inspection and open a business. So when we get to the point, whenever that may be, we'll be able to, we're going to go all hands on deck in the office, split up the workforce and go out and get everybody up and running and ready to go for whenever that day comes. Sooner, hopefully rather than later, but whatever it takes for it to be safe.
Good. I just anecdotally got takeout from Bamboo on Saturday night and ordered it. And they said, when you drive up to the front door, call. And I did. And they said, it's not ready yet. So I sat there. And then when the order was ready, they opened the door a little crack and put the bag on a table outside the door and said, okay, is this you, Michelle? So there was very little contact whatsoever.
Wow.
Subsequent to that, I think they have published a much reduced menu and reduced hours since Saturday night.
Yeah, we couldn't order from them Saturday. It was too busy.
Oh, I went early. I went at like 2 p.m, figuring it'd be really quiet then and there would be no lines.
Have there been any complaints about public gathering? Anybody, have you noticed?
The only public gathering complaints there's 2 spots. One is Market Basket. Some people feel there are too many people in there. I don't know that we'll ever get over that complaint as long as they're open.
Yeah.
And the current governor and commissioner's order actually does not allow us to reduce the number of people within that establishment. It has to stay at the 40%. We can't make it 35. It's meant to, we're not allowed to make it more restrictive in any way. And the other place is we are hearing complaints about a lot of kids at the skate park.
Mm.
We're trying to monitor how many are going there and figure out if it's truly a problem. And if need be, I don't have an issue on closing the skate park if they can't keep that number to a reasonable amount. We heard reports that there were 20 to 30 people at a time gathered there over the weekend. If that happens to be the case, this weekend, we're going to monitor it. We're going to recommend that the Parks and Rec close it altogether.
Yeah, yeah.
Have the police been on board with enforcing
Are
that?
they
with us?
monitoring it, Parks and Rec?
Parks and Rec is not monitoring it on the weekends that much. I mean, usually the police are, but I don't see it any different than any playground. It's just a different set of equipment. And instead of kids instead of kids on a swing, they're
Yeah.
on the board with wheels, and it's an enclosed area. And quite honestly, maybe it could just flat out be closed now. I mean, we took the swing sets away. Why are we not taking that away? It's the exact same concept.
Yeah.
Except that maybe they're not touching surfaces as much as you are in a playground. They're, you know, they're on their own individual surfaces on wheels, and so less.
Right.
But if 20 kids are gathering, that's defeats
Well,
the
the numbers would make it a problem.
Right.
So that's the only difference I see is that's the one spot that we see a lot of complaints as far as the social gatherings.
I mean, it really is a shame because, I mean, it's showing how important spaces like that are to people. As the weather's getting great and people want to be able to do fun things, it is a relatively safe thing to do if the numbers were very low. I wonder if just some signage or something that says kind of, you know, whatever you determine is a safe number of people in the park, and then just like get to wait your turn until the park is free.
Yeah.
I don't know. I hate to close it because you're right. It is different than a playground where you're touching, you know, a slide or a pole, and, you know, it's constantly doing that. I don't know. I mean,
I
kids,
certainly
you
see
play
what the-
some-
Maybe work with Parks and Rec and see if they can get somebody to be there and just monitor and just
I
let
can
people
see what
in
the
or not,
perceived
you know?
I'll check to see what the occupancy of that space is supposed to be, and we can reduce it. I mean, the grocery stores are at 40%. There's no reason why that shouldn't be.
Yeah, because if we said something like, you know, reduce to a certain number of people, if it goes above that, we're going to have to close it. At least we're warning them that, you know, if you
Right.
guys can regulate, great. If you can't, we're going to have to close it. Do we need a motion to accept the resolution we just made? Do you want me to read it off?
I would say so, Zach.
Okay, so does someone want to make the motion to make a resolution to strongly recommend the wearing of face coverings for the public when they're attending public buildings or essential businesses?
I'll make the motion.
Okay, motion made. Is there a second?
Can we discuss, I think, did Jeff also say when entering or exiting?
So the things I have on my list to add to that would be face coverings in public buildings. All employees are strongly advised to wear face coverings in businesses open to the public, and all workers and visitors to commercial complexes shall wear face coverings in and out.
Okay.
Okay, so motion made. Is there a second?
Well, second.
Motion made and seconded. Any further discussion? Anything anyone wants to add or take out of that resolution? Is there, so the vote for the resolution, those in favor, please say aye.
Aye.
Opposed? Is unanimous. Great. Is there any other updates that you want to give us, Jeff? Anything we need to know before our next meeting?
As far as updates, I would say I've got all of them on the website as far as the amount of people that have come down with COVID-19 in town. I keep that updated. I try to daily. So far, I've been very good about that in keeping with that numbers. We're fortunate as compared to other communities. We're only seeing at this point 2 to 4 a day in increases, but knock on wood, hopefully we don't see the market increases. We're still working on getting additional access to the Maven system with more nurses in an effort to be prepared if there's a surge of cases in town. And we also now have putting the finishing touches on an agreement with Lowell General and Circle Health for all town employees to be tested whenever there's a need to be a test. We got standing orders from Dr. Athanasu, our town medical director, and they were passed in to Lowell General where he is on staff. And we now have a system where town employees can send an email in with the information that's required, and they'll be given a time to get tested as opposed to go standing in a line such as at a Gillette or at the rapid testing facility that's also in Lowell.
Are you talking about people that are symptomatic, right? Not just that they want to get a test? Correct.
No, they've
Exactly.
got to have a reason. They've got to be symptomatic. They just, if we have somebody that's been in direct contact or is a close contact, they'll be able to get tested. First instruction is they have to talk to their own medical doctor before they are, but this just gives us faster access into that testing protocol for them as opposed to waiting in long, long lines.
Yeah, good.
Excellent.
Great. Any other questions or updates from the board?
I know Ray and Gail are on the line. I don't know if they have anything they want to add. I don't know if I can see them.
This is Ray. I'm good.
Hey, Ray. Thank you.
Hi, Ray.
Hi, Ray.
Glad you're all healthy. Looking good.
You too.
And Gail wanted us to know that if a person is closer than 6 feet from one another, a face covering is important. Thank you, Gail. That is true.
Yes, this is Gail, and I have no new updates. I'm just busily working right alongside Sue virtually, and I have no new information to pass on at the moment.
Thank you, Gail.
Thank you.
And just thank you again to the Board of Health staff and to Sue, for everyone who's working hard out there day in, day out. I know this must be just so hard. I was just looking at the calendar and just realizing that we've been doing this now for a month.
Yeah.
And it just is like amazing that I think the town's doing a fantastic job. I mean, the numbers really do show it. If you look at Middlesex County and the numbers are over 6,000 confirmed cases, and then you look at Westford, that's telling you a lot.
I know. Yeah. Yeah. And we were talking before off camera about our nursing homes are really doing well in Westford too, which I think speaks volumes as well. So.
Yeah, so thank you to everybody. We will see everyone in 2 weeks at our next Board of Health meeting, which will be on Monday, April 27th at 6 p.m. You can join us virtually. And if anyone out there does have a question or comment for the board, I don't see anyone else on our meeting right now, but if you do, now's the time to let us know. You can raise your hand virtually, or you can type into our chat board so that we can get your question, and we'll try and get that answered for you or direct you to the right person. I don't see anything popping up. Do you see anything, Jeff?
I only see one other person on other than Westford Cat at this point.
Okay, but do know if you're in the public and you do want to be part of our meetings, you can join us virtually. And we will try and hear for your questions. If you have a question and you're watching this on Westford Cat, you can send us an email. You can contact us at our Board of Health phone number. We'll try and get your questions answered. Thank you, everyone, for joining the meeting. Oh, yeah, Jeff?
I completely forgot this one thing. We did get another $10,000 that the Board of Selectmen will be, assuming they're going to accept that tonight, for dealing with the COVID response, which is everything from housing needs to backfilling overtime and staffing as the surge continues too. So that's a total of $20,000 we were able to secure for the town for this response alone.
That's great.
That's good to hear. Great, thank you for that update. So now we just need a motion to adjourn. Is there a motion?
I'll make it.
Sue's made the motion. Is there a second?
I'll second that.
No big deal.
Seconded. Any further discussion? Those in favor of adjourning, please say aye.
Aye.
Hi.
Well, good night, everyone. Stay
Night.
safe.
Bye,
See you in a couple weeks.
everybody.
Take care.
Good night.
Bye. Good to see you all.
Bye.
Okay.
I forget how you exit this one.